Dr. Robert Cutchen, founder of the Albuquerque Vein and Laser Institute, is back joining us this morning to continue our conversation about vein disorders. Good morning, Dr. Cutchen.
Thank you. Good morning. It's good to be here.
Good to have you back. And I want to talk about the fact that spider veins and varicose veins are both common disorders, but yet they are both very different. So can you explain that difference to our viewers?
Yeah, spider veins are those little tiny, they can be red, they can be purple, they can be blue, those real small veins that are a lot more common in women and men, but they're just the little guys you get.
Right.
Varicose veins are more of a medical problem, and these are those big bulgy veins.
Right.
When we talk about veins, it's important to understand that the job of our veins is to carry the blood up and out of our legs.
Right.
And inside of our veins, we have these little valves, and these little valves open to let the blood flow up.
Yes.
And it allows the blood to flow up, and when we squeeze our muscles, but gravity is always working against us, and when that happens, gravity pulls the blood backwards and these valves snap shut, and that prevents the blood from flowing back towards your feet. But varicose veins have broken valves, and so the blood flows backwards. That puts a lot of back pressure and congestion in the vein, and that contributes to symptoms of heaviness and aching and tiredness and can cause those veins to bulge. And so the spider veins are generally considered a cosmetic problem, whereas the varicose veins are causing symptoms of discomfort. And so those are considered a medical problem.
Almost thinking of it like spider veins are the veins, you know, the ones that were your vanity, so to speak, right?
That's a good way to look at it.
Well, I mean, can the vein disorders be avoided altogether, or are they just a fact of life?
You know, in many ways, they're just kind of a fact of life. The biggest cause of spider veins and varicose veins is genetics.
Okay.
I got my varicose veins from my mom. She got them from her mom.
So
they're more common in women than men. Every pregnancy makes them worse, jobs where you're on your feet, so things like that. So while there may be some things we can do, in many ways they're kind of just something that we deal with.
That we just deal with. Well, are they treated in different ways?
They are, and we're going to talk a little bit more in a minute about spider vein treatment, which is called sclerotherapy.
Yes.
The varicose veins are treated in different ways. Some veins are actually treated with a laser that we put inside of veins.
Right.
Some veins are treated with ultrasound-guided injections, and those big bulgy veins, we actually make little incisions and kind of pluck those out under local anesthesia, and we literally get rid of those so your legs are nice and smooth after that.
And it's although it sounds a little scary, it's really not, because it's in and out. I mean, you're out in the same day, right?
It really is. Everything we do is done in the office, and so after you're done, we send you outside and you go for a walk after we're done. So you're immediately back on your feet.
I mean, we're seeing that now. Now, what are we watching exactly?
So this is sclerotherapy, and sclerotherapy is the treatment of these spider veins. So what you're seing right here is kind of that's a big vein. That's a big spider vein. That's called a reticular vein. And as you see, when we inject it with a liquid chemical called sotradecol.
Wow, look at how it's changing in a moment.
It literally kind of disappears, but just for a second, and that chemical goes in there and chemically damages that vein and closes it to make it disappear.
It's like miracle work, Dr. Cutchen. I mean, it's that quick. I mean, and you also have mentioned to me that now is the best time to get your veins treated. Why is that?
Now is a great time to get your veins treated, because especially when you're talking about sclerotherapy, it requires multiple treatments. Now, those veins do disappear. They disappear for about 5 seconds because we're pushing the blood out of them. We're pushing a clear liquid in there. So they disappear just for a second. And then that chemical works on the vein to chemically damage it and close it, and they slowly fade away. It does require multiple treatments. So the example I always give people is it's like scrubbing a stain out of a shirt. You scrub and you rinse and you scrub and you rinse. And large clusters of spider veins, you're going to kind of have to hit them multiple times, and they'll slowly fade away.
Okay. Well, what about those laser treatments?
Now, laser treatments have been used on spider veins. The lasers that I have, I'm telling you about, is for large varicose veins. Laser treatments work great for real small veins, oftentimes on the face and things like that. When it comes to the legs, lasers will work okay for the real small veins, but nothing works as good as sclerotherapy on the legs. So it's really the gold standard for the legs.
I've seen it on hands too a lot of the time. Is there one in particular that you see more on hands?
You know, on the hands, you're mostly talking about kind of large, bulgy veins, and I kind of have that too. And we really don't mess around too much with the hands unless they're really causing people a lot of discomfort. I typically kind of tell them just to ignore them unless they really are bothered.
Yeah, they're not that bad, but I always thought that. I always wondered about your hands, because I know a lot of people talk about that. Now, what's really great is that you're actually offering a free screening, and that's fantastic. So can you tell us what's involved with that? Yeah,
our screening appointments are about 10-minute visits where a patient can come in, have a chance to meet me. We'll talk a little bit about what's going on with their legs, if they're having any symptoms of discomfort, if it's more of a cosmetic problem, and then I can talk with them a little bit about our treatment options. And some of those patients, I'm going to recommend they come back for a more thorough evaluation where we're going to do an ultrasound of their legs and figure out if they really do have more of a medical problem that we're going to build the insurance and do a little bit more involved treatment.
And that helps to know that insurance can cover that as well. I mean, I think a lot of times if people are worried, just to get that free screening and get that comfort level from you to know, you know what, it is just a vanity thing versus it is a medical issue.
Right.
And that's a really helpful thing. Let's show everybody where they can go for more information so they can come in for those free screenings as well.
Well, we can be reached by phone at 848-VEIN, which is 848-8346, or you can find us on the web at albuquerquevein.com.
Thank you so much, Dr. Cutchen. It's always great to see you and really valuable information for so many people out there.
Thank you so much. Great to be here.
Appreciate that. And coming up next, we are meeting another one of Santa Fe's top chefs who's competing in the Santa Fe Harvest Festival. David Sundberg of the Blue Corn Cafe and Brewery is up next. Don't go away. Yum.